Hey, welcome back into Good Morning Arkansas. Today is Red Awareness Day. We're going red for women today for a good reason. We do this every year. It's because it's important to raise awareness, and we're talking with two people this morning who are very important in that realm. It's Dr. Jean McSweeney, professor and associate dean for research in the UAMS College of Nursing. She knows a lot about that because she was actually the first to identify different heart attack symptoms for women and is known internationally for her research. We've also got another research doctor, Dr. Rojo, this morning. Thank you two so much for joining us and talking about this. And this is something we've talked about throughout the morning, and it's an annual thing. But Dr. McSweeney, looking back at your first time realizing that there were different symptoms, what was that like for you going through that research path to discover that maybe we should be looking at some other things, in particular when talking about women?
Well, I just suspected it from working in a clinical unit in critical care and saw that women had worse outcomes after having a heart attack.
Okay.
And it led me to do some research in this area. And when I started it, there were no studies that focused just on women. They focused on men. And so in order to get funding, and I would like to thank the American Heart Association for funding this first study of just women, and then the National Institute of Health funded subsequent studies after that. But it was wonderful to be able to help women get diagnosed earlier. And many women in my studies said that they were actually happy when they were diagnosed with heart attack because now they knew what was wrong with them.
Oh, wow.
That they had had these early warning symptoms that our study was able to identify.
So let's go over those symptoms for those out there who maybe not be aware of all of them. What are they, and what can people look for if they need to know that they're having a heart attack and they need immediate medical attention?
I'd like to talk a little bit first about the early warning symptoms that women have so maybe we could prevent them from having a heart attack. And women typically report unusual fatigue, and this is fatigue. There's no reason for it. They are tired when they go to bed. They're tired when they get up, and they can't do their usual activities of daily living. They get so tired with this.
Okay.
And so I want to stress that it's unusual.
And what ages are we talking about with I mean, it's broad spectrum, or is it typically after a certain age that symptoms like these early onset symptoms happen?
Typically, we have seen in the past women usually around 65 and older.
Okay.
Unfortunately, with more obesity, more diabetes, less physical exercise, we had women in our studies as young as 29 that had had a heart attack. And it's really this young group, and Dr. Rojo is going to talk about this young group. That's the most at risk. But I want to say that women in Arkansas, this is the #1 killer, and they have got to pay attention to their risk factors.
All right. Any other early signs that we should keep in mind other than fatigue?
Shortness of breath.
Okay.
And it's when just walking to the mailbox or walking up and down steps that they have not had previously. Anxiety, they will get anxiety will come on, and we call it fleeting feelings of anxiety that will come and go, and frequent indigestion that they had not had previously.
Okay, and you want to talk about the younger demographic and also minorities that could be affected by this, Dr. Rojo. What have you found in your research, and what do you try to teach over there at UAMS when it comes to this?
Well, we know that minority women basically they don't know. You know, they're lagging in the information. So we have women that really don't know that in minority women, we're talking about African Americans and Hispanics, they don't know that heart disease is their #1 killer. I mean, they don't know they're at risk, they don't know the symptoms, even though we do have the information, and sometimes it is translated, but they don't have it. And I think they don't have the information because the venues they were using, it's not the venues that the women frequently visit.
Okay.
You know, they may not go to hospitals or clinics because they don't have health insurance. So I think we have to change how we deliver our message. It can't be just in the hospital setting or institutions.
Yes.
I think we have to engage the community and go to the community because they really don't have the information, even though it is available.
And you don't want to wait till it's too late, till they're already in a hospital feeling the effects of those symptoms
Exactly.
and some type of cardiac event, right?
Right. We want to do it before.
Okay. And
I would say, too, that once women have a heart attack, they have worse outcomes, and so we really try to look at prevention. And the take-home message really from this is for women to know their risk factors and be able to do something about it so that they don't progress to a heart attack.
all right.
We want women to really try to really be cautious about their weight because we know overweight is a huge problem in this state. And one reason it is because we don't have enough physical activity. And we used to tell people they had to do aerobics, they had to do all this kind of activity, and we don't really stress that so much anymore. We just ask people to move. A lot of people have ways to count steps, whether it's on your phone or a Fitbit or Apple Watch, something like that. And we would really like people to do that and keep track of their steps and try to improve that. Because if they can lose weight, if they exercise, they can lose weight, and then it will decrease their chances of developing diabetes, which is another big risk factor in this state.
What about family history?
Family history is something you can't change.
Sure.
These other things are something that you can change.
Okay.
So if you know you have a family history, that's all the more reason that you should really pay attention to these risk factors. One thing I really like to tell women, they don't like to hear this particularly, I tell everybody really, whether it's men or women, is that one simple way to get exercise is when you go to a store, grocery store or whatever, park your car way out so that you have to walk more, so you get extra steps. Because now we call up, we order them online, whatever, drive up, we don't even walk into the store. So I would encourage people to walk more.
Very simple way to do that too. Thank you two so much for coming in today, and thank you for all that you've done and raising awareness and educating. It's such an important process, something we have to keep doing, get those numbers down. We do not want to be number one in that ever again.